One final question. What's next technologically? If it's mobile phones today, what do you foresee as the next technology that has potential for the biggest impact on global public health?
Well, I think if you just want to pick one thing, it's got to be robots. You know, if you don't want to go to a convention, you can just send your robot to come to these conventions. I mean, seriously, when we look at something like maternal mortality, there's a certain level you can't get below if you can't do C-sections. And doing a C-section requires a sterile environment, a certain amount of expertise, and yet in some ways it's fairly routine. And so if you could have a robot that can do that, that's fairly inexpensive, that's a great thing. If you can have robots for elderly care. Anyway, you know, computers are going from just sitting there and you can only type into them and just see something on screen. They're going to where now they can see, and you have high-end visual applications, like the military likes to see things, so they think that's cool. And Xbox games, Kinect. Yeah. They like to see you bowl and play tennis and crazy things like that. So the computers, it's learning to see, it's learning to talk, it's learning to listen, it's learning to do handwriting, and it's learning to move around. And the ambulatory stuff is really moved a lot. In the lab, it's phenomenal, which means 5 years from now it'll be quite cheap. The dexterity things are maybe 5 years behind. One of the hardest dexterity problems in the world is, say you have an elderly patient sitting on a bed, and you have to go and lift that patient up and carry the patient over and then help them get dressed or take them to the toilet. Humans are surprisingly good at this. Just the amount of feedback and understanding of the balance and different things. That's a hard problem for a robot. But the nice thing is once the robot can do it, then it doesn't forget how to do it. And it can do it 24 hours a day, and the price of those things come down. So that's a big thing. Also, biological knowledge. Now, I was with these pharma CEOs. We don't understand shape space. That is, we can find a receptor and not know what small molecule drug will go in and affect that receptor and test the other receptors we don't want to go into and make sure that we have something that doesn't go in there. There is a level of biological knowledge that we're going to have over the next 10 years that's going to be phenomenal. And we'll have rational drug design. We'll have genetic therapies that can actually work. So when everybody shows that healthcare costs going to infinity, which is a nice trend line analysis that you can do, I don't really believe that's going to happen. But you have to really believe in innovation, that our biological knowledge will take leaps and bounds. And the drug discovery rate over the last 10 years has been very low, which sort of runs counter to the fact that we've learned all these things. Well, these are very complex systems. So, I mean, truthfully, even though I'd put robotics second, biological knowledge, it trumps everything. Our ability to discover drugs using computation to do a lot of kind of hit and miss and messing around type things that are done by humans today, that is changing in a 10, 15-year period. It'll be utterly different. And, you know, if we're smart about it, it'll benefit the poor as well as the rich.
Indeed. Well, thank you very much.
Thanks. Great. Good job.